Recording started.
Okay. Welcome everyone to this meeting of the Health and Care Scrutiny Panel. Item Agenda 1, our apologies. I have received apologies already from Councillor Virgo. Are there any other apologies?
There are no other apologies.
Okay, thank you. Item Agenda 2, declarations of interest, and anyone party whip. Does anyone wish to declare an interest or note they are working under the party whip? So we're going to the next thing, which is colleagues, this is the chair. Colleagues, the chair position is currently vacant. Under the Constitution, the chair of an overused group panel must be drawn from among the councillors sitting on the panel, and the panel may appoint such a person as it considers appropriate. We will now elect a chair. I invite, as vice chair, nominations for chair. Please note that nominations must be proposed and seconded. I have nominations. Yes.
Seconding, I think, Catherine.
Nominations.
Sorry. So I'm nominating, I'm nominating Joey Webb to be chair of this panel. I'll second that.
So, thank you. I've now got nominations for chair. So I now hand over to.
Yes, there's. Right, thank you. I will now invite nominations for chair. Nominations must be proposed and seconded. Are there any further nominations? Nominations for chair?
Yeah.
Right. Right, if not, nominations are closed. Presiding councillor or vice chair, if they're not standing, we will now vote. The appointment is by simple majority. So be voting for yes. Put your hand up, mention T.
Apologies.
Right, so I take it I'm chair.
So that's a majority vote.
Right, thank you, councillors. As a consequence of that appointment, the position of vice chair is now vacant. Under the Constitution, ordinary meetings may receive items of business that the chair decides are urgent. I have decided it's urgent to appoint a vice chair today, so the panel is properly constituted for the remainder of this municipal year and to support the work programmed. I will therefore take election as vice chair as urgent business. I invite nominations for vice chair, and I'd like to nominate Councillor Preston for vice chair. Could I have a seconder, please?
I second it.
Okay. So I now have Councillor Preston proposed and proposed by Councillor Webb and seconded by Councillor Preston. Are there any further nominations? If not, nominations are closed. We now vote on this. Right,
Start focused on that else.
right, okay, so now we can go on to own business. So
Sorry, I'm just going to the same one instead.
item agenda 4, sexual health contract procurement. Can I welcome Cabinet Member for Adults and Public Health, Councillor Wright. I'd like you to give your presentation on the sexual health contract procurement today.
Okay, thank you very much. Thank you, Chair. If you have so kind as to, oh yeah, okay. So we are in the process of recommissioning our sexual and reproductive health services. We've been through the whole process, and I think it starts in July this year. Okay. As you all know, we've already been to overview scrutiny with regards to our sexual and reproductive health services, and have taken on board a lot of your recommendations in our recommissioning. So our aims of this were to improve our reproductive health outcomes, and reduce health inequalities in Berkshire, and to provide an integrated sexual health service as per national requirements. Berkshire, because this is a partnership with Slough and Windsor Maidenhead, and we are the main partners in recommissioning this. And what did we want the integrated sexual health service to include? We wanted levels 1, 2, and 3. So level 1 is level 1 is the most basic level of sexual and reproductive health services, and level 3 is very specialised services for people with sexually transmitted diseases who need specialist care. We also wanted to improve our online sexual health services offer, to have outreach services and public health campaigns. We also wanted to ensure that our sexual health staff didn't work in isolation, that they trained GPs and other practices and worked on a wider reach, and so that also therefore we had a comprehensive sexual and reproductive health promotion model. Okay, if we could just go to the next slide. So these are our needs. I'll just quickly, obviously there's quite a lot there. The ones that I think are quite important to us, because they were things that were flagged up as issues, was we needed to have more online services, especially the chlamydia testing, because that quite often ran out in our contract. We used up our monthly contract quite quickly. We needed better hours, opening hours in Bracknell, because previously our main clinic day was Monday, and we had some really bad luck with a year of lots of bank holidays on Monday, so actually we had a very reduced service that year, and we wanted to have a service that addressed that. And then improve the quality of the venue of the Skin Till Clinic as well. These slides is on your pack. Everything else I think is probably stuff, quite obvious stuff. I'll just move to the next slide. So I'm just quickly looking at reflection and specification. Okay, that's fine. We wanted to ensure that we had good partnership working, so we working closely with GPs and pharmaceutical services, actually part of the sexual and reproductive health, or part of what we offer, which isn't in this contract, is that the long action is a separate contract, but obviously part of the council's responsibility is to also offer long-acting implantable contraception, and we wanted to make sure that we had a joined-up service, that the GPs knew what was being provided where and who was responsible for it, and then and also to continue with our promotion and delivery of HIV prevention programmes, including provision of pre-exposure prophylaxis and pre-exposure testing as well. And then also we identified areas of special risk, young people with special educational needs, and some of our harder to reach communities due to maybe different cultures and things. So looking at how do have a wide provision for everybody, and we also wanted to make sure that we, as I said previously, that we did some work with teachers and with health providers within schools and youth projects, and also working with voluntary and community sector organisations to make sure that everyone knows about the offer that's available across the borough. Okay. So looking at the digital first model, I think we did a survey and realised that people did like to access services online. One of the challenges was we needed to improve that. So we've improved the website, and again, that was partly from feedback from you guys when we came to overview and scrutiny. It's been well over a year ago, but anyway, so we bore in mind some of the things you said. We've got a much stronger. We wanted a much stronger digital model, and so you could request condoms, request emergency contraception, request testing all online to get a better service, and that means that you've got a better capacity to reach lots of people. You're not so constrained by opening hours and travel times, etc. Okay, next slide. And then obviously you can't do everything on digital, and you have to have services. We wanted to have a good outreach service. I mean, Jan Welshew is one of the nurses, was doing outreach, but we wanted to sort of strengthen that model and improve that model and make sure that we had a consistent model with outreach. So aiming for young people under 18, people with learning disabilities, special educational needs, ethnic minorities, people living in more deprived areas, asylum seekers, refugees and recent migrants who might be aware of the services available, commercial sex workers and people from the lesbian LGBTQ community. So we wanted to make sure that we were able to reach those populations and they were aware of the services that were available. And then in part of our outreach services, health promotion, promoting our online service and our face-to-face service, promoting condom use and distribution of condoms, people being able to pick up tests and being able to get face-to-face contraception support and advice, and then supporting the what's that, RSHE? That's the Royal Society of Health Education, is it?
Relationship sex.
So relation steps and health education curriculum, Cross Berkshire East, and also sexual and reproductive health training. So obviously it's a it's a shared contract with Bratton Forest Council, Slough and Royal Borough of Windsor Maidenhead. The percentages reflect the amount of uptake across the three boroughs, and so the contract is weighted to reflect that need across the three boroughs. It's a 5-year contract with the potential to extend for another 2 years. It's within a relative. There isn't a, what was the previous contract? It isn't particularly changed. I mean, it's got some inflationary.
There's inflationary year-on-year increase, and there's probably an initial uplift of, I think it's around 200,000.
Okay.
So there is a slight upgrade, but we obviously increased the digital and post outreach.
Yeah. Okay. Yeah. And then this. So looking at the next slide, the next slide is just about how we evaluated the programme. So 3 is a high score. Out of 4 or out of 3? Out of 5. So this is so we scored on bids, and the one that was awarded bids had the best scores. I think in the end we had one bid that actually got through to the finals. Is that right? Yeah. And then moving on to risks. There is a risk that the provider may not deliver all requirements set out in the service specification. Mitigations, regular service meetings, contract monitoring meetings, annual service reviews. There is a risk that the online service becomes fragmented between the provider and the subcontractor, resulting in a disjointed. Ensuring integration during mobilisation, regular service meetings and contract monitoring meetings. And sorry, I should have introduced Alex. Alex has been involved with the commissioning of this, and obviously Charlotte here is our Director of Public Health. Alex here has been involved with the commissioning. I presume that you've been involved in designing the online and taking into consideration what a lot of people have said, and also the work we did. Your predecessor Bex did a lot of work on sort of finding out what people wanted in the online offer. And then financial transparency may be unclear, making it difficult to monitor value for money expenditure and reprioritisation. Financial review process of withdrawing mobilisation incorporated into contract sales, because obviously it's across 3 boroughs. There's weighted use for boroughs, and just to make sure that we're sticking to that, you know, that it is being used in that way to make sure that it's okay. And then all right, so that's I've just gone over the slides very quickly. What I would say is we have got a much better offer with regards to clinic times, and so previously our main session was, we had like 3 half-day sessions, and one of them was specifically focused on providing contraception advice to everyone, but we actually had but it seemed to be used mainly by older women who were in relationships, and it wasn't good uptake from young people. So what we've done now is we now have 3 days where we've got off where the clinic is open. So that's Monday from 10:30 and open all day, not just half-day sessions. So that's Monday, Wednesday and Thursday, which protects us against the whole, if it's closed on bank holidays, there isn't any provision for another fortnight or a month days. And then we have outreach days on Monday, Tuesday, Thursday and Friday. So that's when our sexual and reproductive health team will go and visit schools or go and visit relevant projects. So that's a big change. The other change is the online testing kits have gone from, I think we had a weekly ration of 15.
So it's a daily ration of 17.
Okay,
17 has gone up to daily 40.
Daily ration of 40, because what was happening is we were hearing that people would they would try and get kits and they'd run out, especially when, you know, and there's been sort of local panic about chlamydia or something. So we've improved that. So hopefully a daily sort of quota of 40 tests a day, we should protect against running out of kits. I'm just trying to think what are the other significant changes from the and we've got a commitment, this is for you, Councillor Berger, a commitment to refurbish Skimpert Hill from the providers that they said they've acknowledged that it needs a refresh. So they're going to be working on improving.
Do we, sorry, interrupting.
No.
Do we know quite what that means?
So it's not the providers that's doing the refresh. So NHS Property Services have said that they will be looking at doing the refresh of the site with people leaving and people deciding to change slightly. Not really sure what that means at this stage. They're not really able to give us any more information. I think they're waiting for the new site to be built before they start looking at the current Skimpert Hill site.
Sorry, can I say on that? Could we actually?
Can we wait for the presentation?
Yeah, sorry. Well, I think that's it, really. I mean,
Just following up, just on that.
Yeah.
Right then, okay, in that case, can we move on to questions, please?
Could I just? I mean, I think, you know, my feelings about this. This is just a terrible place to go to, and there's no getting away from that. It's just shocking to me for a borough like this. I mean, I said this on the previous regime, so don't worry, it's not just the Labour Party, it's the Conservative Party as well. But there must be a way, Alex, of saying what we want, rather than us waiting for something and then it's too late to say anything else. We must demand in that contract, you know, a reasonable place. I mean, we must put phrases of words down to say, look, it's got to be this, and it's got to be much easier for the public to go to. I mean, I'm absolutely pleased it's 3 days. I think that's absolutely brilliant. And that's a huge advance, actually, to be honest, from the previous from the previous idea. But we've got to get them to somewhere that's reasonable to look at and talk to. That's
I guess it comes down to, I mean, we can definitely look at the refurbishment of site, but kind of responsibilities of who does that lie with, and budgetary costs of doing that. The other thing is that I guess there's loads of different mixed reviews on kind of how sexual health services should be promoted. So lots of people actually want a confidential space that's not overly promoted, that people aren't aware of, that they're accessing. So then it doesn't feel as stigmatizing or kind of discouraging from people to access. And I think there's two mindsets. There's always two mindsets of it: is trying to normalize a place and kind of overly promoting it and trying to attract people, but also kind of being mindful of the people that don't want that. And I think hopefully through kind of the panels and the forums that they're setting up, so they've set up a lot more kind of forums, so Young People's Forum, they've set up a PrEP forum, they're going to be setting up multiple other forums. They can start to talk to people about how they would like the service to be promoted. I think that's kind of the best way for it to come from our residents in terms of.
But Alex, I must interview. I mean, we've had this argument so many times on this table before you came, actually. And don't worry, Mr. Berger, because this is all done offline, and they much prefer to do it offline. This doesn't go very well with the number of people that come from this area that have to go to Slough. It doesn't work out. Because if that's the case, why do people all go to Slough? I just think I must dig in this, that we expect, certainly in this regime, because Megan, you've made great advances here. So let's keep going. We must expect a better place for people to go to. Now, I buy your point that it's got to be discreet. I mean, if you've gone to Slough, it works perfectly well. You sit in the waiting room when you're called. It's all anonymous. Nobody knows who you are. You're called in, and there's a discussion with a clinician. We've got to get to that somehow, Alex, and not always say, "Don't worry." Sounds like a song, doesn't it? Don't worry, because it's all online.
Sorry, through you, Chair. I agree with you. I think what Alex is saying is we need to understand. I mean, it's NHS estates. It's not the council. I mean, it's contracted with the NHS
services.
Yeah,
But it is our contract.
Yes, and we have made it very clear that we want an improved service. I suppose it's also seeing what's going to go into the new health centre and how much space that leaves in Skipford Hill, and can we actually build a better area within there with a nice waiting room with better space.
I'm just saying, let's get in there and start.
Yes, exactly.
Finding out where we're going.
And I'm happy to do that.
Okay.
I'm happy to keep pushing.
Could you report back on to the committee on?
Yeah, definitely.
Thank you. And sorry for being delayed by traffic and sort of interrupting your speech. It wasn't to be helped. Looking at the figures for the costs to each individual council, you say it's based on usage. Now, if we substantially improve services at a location in Bretton Forest, is it likely that we're going to actually see our share of users go up because it's more accessible? And does that, because if we're going more, have we been underserved in the past, and therefore our share of this cost is lower than it really will be?
I think the charges, so if we send someone to Slough, we pay for it. So if someone from Slough comes here, they're still paying for it. I suppose that the issue, and we were just talking about this before the meeting started, that maybe people who go to Reading, because actually it's easier to get to than Slough. How's that going to work, and will we see an increased uptake?
Maybe people see their GP or the pharmacist, or find some other means of accessing the service, which takes because it's so inconvenient to go to Slough. And if we make it easier, we may have to find more budget, presumably.
So we won't have to find more budget because it's a block service. So even if the activity increases by we've done our activity assumptions, they've done their activity assumptions in terms of forecasting what we think the activity will look like. And that's why they've submitted this bit, because they presume that the activity will only increase by X amount. But within the block value, what we put in terms of that financial reporting, what we're hoping to do is kind of have those annual reviews of the service to look at where the underspend is, look at where the overspend is, to look at efficiencies. But Bradford Forest won't be paying any more money of that block.
I can see our partners in there starting to say, well, Bracken was taking up a lot more the service than we said. And when it comes to reviewing this, I think we might have to think about costs.
So they've also increased clinic locations in RBWM and Slough as well. So in RBWM, they now have 2 clinic days that they never used to have any. So there's also increased provision in RBWM as well, which is great to see. And then in Slough, obviously, they have pretty much every single day as their main locations. I think all locations hopefully will see an increased provision and increased outcomes hopefully. Thank you.
I've got a question about the testing.
Mm-hmm.
So currently, if you move GP on the NHS app, it will you get asked if you want to be tested for HIV or chlamydia. I just wanted to know if you forecasted for that, if people are taking that option up to be tested. You might not normally, want to be tested.
Yeah, so with your GP service, we don't pay for any of that. So so GPs often offer new registered patients HIV tests as part of NICE guidance. So it's usually in areas of high HIV prevalence. I mean, it's great to see that GP practices are doing that in Bracken Forest, even though they don't necessarily need to under NICE guidelines. But they do pay for that all themselves. So that doesn't really impact our budgets. But what we have done is anyone that's diagnosed with HIV will then be referred to the HIV care and treatment service follow-up testing.
Any further questions?
Just ask one, unless anybody else wants.
No.
That's fine.
I still go back to the kits, and it's good that we've increased that to 40. If someone applies and those 40 have gone, is there something on the web that says you can apply tomorrow so they don't feel they've lost out?
So on the website, it does say that the kits release, I can't remember what the time is, but it says around the kind of kit release time. So it does encourage people. But what we're trying to do is look at kind of other ways to promote the other services. So what you can do, what is a really great offer that they have is you can actually go into the clinic and they'll give you kind of a kit to go and do in the bathroom, and then the health advisor will just take your bloods, and it's a very quick process that if somebody wants an urgent test and they can't get a test online, they can do that process, and then they currently offer that, but they're looking at promoting it a bit more with their website refresh.
I'm just wondering whether we can put on the website, once it's expired, that more kits are available. Yeah. So
I don't know if that is already on there, but I will follow it up. I'm sure it will.
And can I also ask about the 3 days? Do we have a doctor for 3 days, or where do we?
Yeah, that hasn't been disclosed. If they are offering level 3, I don't know if that's level 3 every day, but if they are offering level 3, there needs to be a doctor. But that hasn't been. We're not at that stage in the mobilisation to be.
I know this is all money, but I wonder if you could bring back that to the committee and tell us if that's, because obviously we love doctors 3 days.
Yeah. No more questions. So now we will move into debate. So I'm seeking recommendations for cabinet members. Anyone got any recommendations?
Can I just say that I'd like those points taken back to the committee on the,
Yeah, that's
just
fine.
about.
Yeah.
I just wanted to add to that.
Yes.
That's okay.
Yes.
Do you have a timeline for when we could expect that for the answers from NHS properties?
Yes, no, but we'll find out. Yeah.
Just read those
It
back.
might be slightly dependent on the new site and what moves into the new site and what space that frees up in the
Yeah,
in the
there's
school
there's
building.
been delays there,
Yeah.
isn't it? Now some of
Yeah.
our services from Great Hollands are going in March now.
Just an
And
expectation.
there's a big
really.
issue at Great Hollands Health Centre at the moment with water damage, no heating.
Right.
That's
I just ask one thing, Charlotte, can I just ask you, because we're close to the Royal Borough-ish, is there any thoughts that we could get together and kind of improve either, you know what I mean? So we take a bit of Royal Borough for us and we could help them on something else. Is there any close working? Because I see they're paying about a bit more than us, but not a great deal more than us. But
It's very similar.
yeah, I'm just wondering whether we could share things a bit more to make us up to slab.
Well, it comes down to population size.
Yeah, no, I
and,
understand that. I understand that.
So the
I
more
understand that, but that's not what I'm saying. I'm just wondering whether, you know, that money can help us get specialised services if we work together with the Royal Borough.
To kind of that, because I don't think
yeah.
so. Although the cost is split in those proportions, the delivery is not necessarily split in that manner.
No.
So the outreach, for example, currently is only delivered in RBWM and Bracknell Forest, and the provision will be equally split across the 3 boroughs going forwards, and that's how we've attributed the costing. So although the overall cost looks like we'll only get a quarter potentially of the service, we're not getting a quarter of the service, we're only paying a quarter. We've actually got kind of the second most clinic sites, and then in terms of the outreach and the online, that won't be split a quarter. Like, we don't have a cap, so if all of our residents take all 40, then that's
Do
how it
we
works.
talk to the Royal Borough?
Yes.
We do.
Yeah, we
So we can see if there's anything that we can.
We have monthly meetings
Yeah.
across East Berkshire, and we have not quite monthly, but quarterlies with our finance colleagues, looking at the activity, working with all the sexual health leads within each of the local authorities. Really good close working relationships. So yeah, it absolutely, and I think it comes down to us contract monitoring and us having an understanding as to access
What's going up
and
and
to
what's coming
provision,
down. And all this stuff.
rather than comparing, because the split, we're the smallest in population size in its entirety, and our need is also less. So we don't require as much service as the others because the need isn't as great.
Right. Contract. So we've got 2 recommendations. So you move through what they are.
I think it's sort of one really just feedback, or you to feedback on the questions about the doctor cover and the NHS properties on the repurposed unit.
Okay, that's it. That's fine.
So I think we also get feedback on the testing, how that goes with increasing it to 40 per day.
That's a good idea. Yeah, that's a good idea.
So those kit costs.
Easy for you to say.
Yes.
I'm not,
So I've never stopped.
I would be, schools. I don't know
They're
how
very
much
good.
the kits themselves cost around £2 something or £3.
Good. Okay.
The laboratory cost is where it comes in.
Yeah.
That's it. It's the testing.
I'm not too sure what the laboratory
That's
costs are.
the cost is the testing.
Yeah.
Okay, thank you very much, Councillor Wright. Thank you very much, Alex. Great presentation. Right, so now we'll move on to agenda item 5, which is smoking, vaping and tobacco control. So I'd like to welcome Director of Public Health, Charlotte Pavitt. Charlotte, and we should have Sean, who is online.
Yeah. Good evening, members. Sorry.
Okay. Right, so we're going to have a presentation on your smoking, vaping and tobacco control. Brilliant, thank you.
Yeah, so if I start, everybody should have received the briefing paper that's circulated within the pack. I'm going to talk to that and then hand over to Sean to talk about the wider tobacco control from the Public Protection Partnership's perspective. So as it states in the paper, that smoking still remains the largest preventable cause of illness and death
nationally and within Bracknell Forest. We know that we've got over 14,000 adult smokers within the borough. And whilst we have seen a consistent reduction in smoking prevalence, there has been a leap in 2022, which we're putting down to largely artefacts. So the way in which the Health Survey for England has the survey methodology, it shifted to an online and telephone survey, making it more accessible and possibly having an increase in engagement of individuals who smoked who completed that survey. We don't think that that's a true leap in prevalence, because that hasn't been seen anywhere else in the country. It's a random sample, so that has seen us jump up above the national average, and therefore that continued reduction that we have seen since 2002 still puts us higher than our southeast average and our national average. So in short, smoking still remains a significant public health priority for us to tackle. Vaping is comparably new on the block in terms of health impact behaviours, and we have less insight into our local uptake of vaping. Nationally, we think around 11%, which we would also assume that's the case within Bracknell Forest, of adults vape, and we know it's also an issue with our children and young people. And again, national NHS figures suggest that around a quarter of our children and young people have tried vaping, and 1 in 10 vape regularly. So again, alongside smoking, vaping is also a significant public health priority for us to work and focus on. Our position mirrors the national position in terms of vaping. Vaping is an evidence-based aid to quitting smoking, and therefore we do use it within our smoking cessation services as a tool and an aid for those who are trying to cut down or quit smoking. However, our line is very clear that if you are not vaping, you shouldn't start vaping, because the long-term consequences are still unknown in their entirety, and it's the position is safer to not vape, and that is of course the message for our children and young people too. So therefore we have from a public health perspective a dual approach. We have Stop Smoking, smoking cessation service, and we also have a wider tobacco control programme that sits alongside regional work and also the work of PPP as well. So for our smoking cessation service, our Stop Smoking service, we have always had a universal service that has always been funded by the public health grant. And in more recent years, we've received a supplementary Stop Smoking service grant alongside the core public health grant that we have used last year to commission a targeted smoking service. So our universal service has this year been recommissioned. Solutions for Health are our provider, so Public Health commission those to provide the service, and it delivers an evidence-based stop smoking service. But this refresh of the contract has seen additional support for parents and carers, access to nicotine-free alternatives, quick tools, and obviously the 12-week programme for both vaping and smoking, and that includes for children and young people aged 12 to 18. The providers also offering brief advice and signposting individuals to stop vaping as well as smoking, which is a great addition. And is doing work within secondary schools to look at the smoke-free environment within secondary schools, and also the pathways in terms of for those children and young people aged 12 and above who are smoking and vaping, what the support is available for them to quit and reduce that down. I'll come on to the wider school offer in a moment. But in addition to that universal service, we've also got a targeted service, and that came off of the back of a health equity audit that we undertook in 2024, and then last year a engagement health needs assessment. And it was very clear that there was a gap both in terms of access and actually the outcomes, so the quit rates and then the harm that's associated with smoking, for certain priority groups. So pregnant women, routine and manual workers, our deprived communities, people with mental health conditions, and also the under 18s. And so we have an additional service that focuses on outreach, on working with those priority groups, understanding behaviours, targeting and aligning the core offer to meet their needs and make it more accessible to them. And again, that's provided, that contract was won and is provided by our Solutions for Health provider as well. So they're doing both the universal and the targeted support. That the evidence base suggests that we shouldn't, but the focus for smoking cessation is for individuals aged 12 and above. Therefore, work with primary schools, we focus more on the generic PHSE, the Personal Health and Social Education Programme, and we're focusing our smoking cessation services on parental smoking, strengthening the pathways through maternity. So the maternity support is not only for the pregnant woman, but also their partner. It's the impact for a child at primary school age in terms of the social norms, the family environment, the environment in which they live is much, much stronger than work and education within school. And smoking is picked up in those generic conversations. So rather than diluting the service down and stretching it out, we're focusing it where the biggest impact is going to be held. As I've said, they are working with schools to look at the vaping uptake and the pathways through to the service, but we aren't going to, they're not experts in education and behavioural science, and so we are going to be working with the Royal Borough of Windsor and Maidenhead and looking at procuring a specialist interactive education provider to come and do some work on top of the service in our secondary schools. And then all of that sits within the wider tobacco control activity in the agenda. There's a South East Regional Smoke Free Alliance that we contribute public health funding to, and that alliance coordinates a regional support largely in respect to campaigns and communications, and then we can then amplify those communications at a local level. It also has an advocacy role in terms of influencing government and channeling the roots and a bigger voice from a regional perspective up to government, and also developing the partnerships with our NHS colleagues, with academic institutions in terms of evaluation and building the evidence base so that we're not doing that time and time again. It's done once at a regional level. And then we've locally also invested in a tobacco control public health officer who, it's a new post, so Megan started just before Christmas, and she will start to amplify that regional work locally and look at developing further the community engagement piece and dovetailing on with that targeted work, but coming and working more broadly with our local communities where smoking prevalence is higher and increasing access to both education, resources and the pathways through to our treatment services. And then finally, and it's been a nice segue to Dawn, we're really keen on looking and exploring further opportunities in terms of more of a preventative approach to the work that the Public Protection Partnership are already doing. We've got the smoking and vaping bill that's set to come in the near future. That will see us having a smoke-free generation. It will also see us having a lot more powers in terms of enforcement. So it's going to dovetail some more preventative approaches, education, winning hearts and minds, ensuring that individuals are aware of the support that's available to then complement the work of the enforcement side.
Thank you, Charlotte. Should I go straight into it, Chair? Is that okay?
Yes, you can.
Thank you. Okay, I've just got a very brief presentation, Chair. It's only half a dozen slides, but I think it is probably easier in terms of putting some structure around what I'm hoping to get across. So just bear with me 1 second. And I will share that now. Okay, that should be coming up. Is that okay?
Yeah, that's fine.
Wonderful. Let me just. So what I want to do is just a bit of context, and it fits in really what Charlotte was just saying. So there are many levers in terms of dealing with, particularly tobacco-related issues, vaping, and also age-restricted products, and some of those are macro. So obviously the biggest one of those levers is tax and duty that basically are placed on tobacco products, and we're going to see a duty in due course being placed on vaping products when the new legislation comes in. So that's a very, very important area. And the reason why I mention that is because obviously it plays into some of the work that we do and why we do it, particularly some of the work that we do around illicit tobacco and smuggled tobacco, because obviously that undermines that policy around taxation, which is deliberately designed to basically to put people off from taking up smoking. The other thing I think it's really important to say is that I've been involved in this for a while. My background is I'm a trading standards officer, but I read a paper about 20 years ago about the approach to tobacco control over in New Zealand. And what that paper was saying was, and New Zealand had been very, very successful at this, was that no one strategy works. So effectively, enforcement's not going to solve it. It has to be a conversation around education, environment, and enforcement, and lots of things that sit around that. And so going back to what Charlotte was just saying, that's why the work in schools is very, very important for that reason. The approach that we take as a service to absolutely everything, and this is no different, is that we take what's called a national intelligence model. And the way that we look at things is an issue. We say to ourselves, how can we prevent it? What intelligence are we able to gather, basically, and what are the enforcement options and tools available to us? So I'll come on to some of the preventative things in due course, but obviously all of those things fit together. The intelligence, the messaging is important to getting the intelligence. The intelligence is very important to getting the focus on enforcement. In terms of our priorities, so we have a 3-year assessment. I notice Councillor Harrison is on the committee, and Councillor Harrison was involved when we started to develop this assessment many years ago. And that assessment basically places one of the key priorities of the service, and there are 7 of those key priorities. There's a number of cross-cutting ones as well, but protecting young people from harm. So it is right up there. We focus on it, and it's an important aspect of our work. And then finally, just to say that there's a wide framework of legislative controls. So when I first started many years ago, basically we first got involved in tobacco work. There was an offence. It was illegal to sell tobacco and tobacco products, in fact. So it includes things like papers for hand rolling tobacco and things like that. And that legislation went all the way back to 1933. The Children's Young Persons Act of 1933, and I think it's probably fair to say, from anybody of my generation will remember that legislation was probably more honoured in the breach, I think, than the observance. Since then, and over the last few years, and in my time I've been involved, we've seen a whole range of controls that have come in. So if you look at the whole issue of tobacco promotion, within that you've seen the changes to the packaging, we've seen the banning of vending machines, we've seen the banning of packs of 10, we've seen basically cigarettes and tobacco products being put behind closed doors in shops. And obviously we saw the phasing out and banning of things like sponsorship, which as someone who likes to look at old sort of cricket videos and everything else, it's difficult to imagine now just the level of sponsorship that was around and how prevalent the tobacco industry messages were at that time. Then there are a range of other controls, trademarks, which deals with counterfeit goods, and counterfeit tobacco and counterfeit cigarettes is a problem, particularly counterfeit hand rolling tobacco. There is basically controls around vaping products, and they are controls that deal with, for example, the level of nicotine in the products, the amount of puffs, I suppose, you can get from one vape, and things like that. And there are a whole range of those controls, as well as things like labelling and everything else, because that although the products are much safer, nicotine itself is toxic, and the products and everything else have to come with certain warnings and labellings. We saw obviously last summer the banning of single-use vapes, and we have responsibility there, and there's a range of tools that we can use to enforce that, including compliance notices and seizure ultimately, and prosecution, fixed penalties, etc. There is then the very strict rules around tobacco labelling, and that's important to us because that is quite often the in to distinguish basically smuggled and illicit tobacco from the products that are legitimate. Basically, well, legitimate in the sense of they're compliant, I should say, with labelling requirements. So that branding, that type of thing that we now see across all tobacco products is very, very important to enforcement. And then obviously we've got age restrictions. For many years now, since 2007, I believe, we've had smoke-free, so the banning of smoking in workplaces and vehicles, actually work vehicles. Now, I mean, the latter is probably one that is a bit more problematic, but there's also very specific bans on things like smoking, vaping in taxis and things like that. And then finally, there are inland revenue offences that trading standards officers are able to investigate. So that would include things like fiscal marking, but also would include things like potentially duty evasion. So moving on very quickly to the prevention intelligence side of it. As I said, this is a service priority. We do work with retailers, and I'll show you a couple of slides in a minute, but you'll see that, for example, ahead of the single-use ban that came in, we wrote to retailers and we had an ongoing campaign of awareness with retailers, basically to get them ready for the ban. The focus of that was getting them to return product that they wouldn't be lawfully allowed to sell after the day that the regulations came into force. So there is a whole range of regular profile raising messages that we have, and I'll say the next slide's just got 2 or 3 of those on there, and they are twofold. One of them is to raise, threefold really, I suppose. One of them is to raise awareness of the risks. The second thing is to raise awareness of our work and the work that the council is doing. I say our work, it's your work that the council is doing basically to tackle this and to protect the community. And then finally, and it's really important for us, is that you'll see on all of our messaging, basically the one line that we always end with is basically, if you're aware of something that you feel is not right, please report it. The public are our eyes and ears in that sense. A range of partnership working, and obviously we have internal partnership working as Charlotte has alluded to with public health, but there are also a couple of national initiatives. Basically, one of them is Operation CC, which is a joint HMRC trading standards initiative to tackle illicit tobacco, and there was Operation Joseph, which we were one of the few authorities. We were one of the lead authorities for this. The shared service was one of the lead authorities for this nationally, and that was to look at the sale of vapes online. We have a small intelligence function, a couple of intelligence officers who analyse the data that we get in and the reports from the public, pull together profiles for us, and then in West Berkshire, I've just mentioned this, we do carry out an annual attitudinal survey, which has been really interesting. We've done that now, I think, for about 19 years. And going back to what Charlotte was saying, what we can see is smoking in young people effectively declining at an absolutely rapid rate, and I think that shows the importance of the approach of dealing with everything from enforcement through to education. And we know from that survey work that we've done that one of the things that basically young people tell us is, you know, there are whole reasons why they've given up. I think the education message has got across. But one of the other reasons was that when we first started doing that survey, 50% of people were telling us it was they could go out and buy these products themselves, basically underage. By the time we did the most recent survey, I think that was probably under 10%, and they were saying to us that these products are almost virtually impossible to buy if you're underage, basically. You know, with retail, has been alert to that and proxy sales and everything else. So that has helped inform and give us an evidence base to show that at least what we're doing is contributing to that overall reduction in harm. So just very quickly, looking at examples of awareness raising, and I can share this presentation with the committee and you see these a bit better, but you'll see there's a couple of examples there. The first and third one that were aimed at basically, the first one's aimed at business, and these are messages that we also sent out directly to business. So that was about the single-use ban that came in on the 1st of June. There is obviously that there is now going to be a vaping duty stamp scheme, which is coming in October 26, and that's part of the new tobacco and vaping bill, which Charlotte's alluded to, and I'll come on to that shortly. And then there are a couple of examples there of basically posts that we've put out, and we do put them out with press releases. And if you Google some of these things, you'll find that some of these articles have been repeated in the Bracknell News, Reading Chronicle, and others. So just finally, really, this last couple of slides on test purchasing. So in enforcement, so we obviously have a test purchasing policy. So every year we carry out test purchases in the borough for vapes, knives, alcohol, tobacco, fireworks, a whole range of products with mixed results. And I'm pleased to say, actually, in terms of vapes, so last year, the failure rate was 2 out of 29 of the vape test purchases we did. So that was really positive. It wasn't quite so positive with alcohol. And we did have some sales of knives and other products as well. So we have this ongoing, basically, market surveillance, intelligence-led thing. We get people reporting stuff to us. And then we will basically carry out test purchases that are either intelligence-led, or we're just basically seeing what the levels of compliance are in the market out there, as it were, in the retail market. Obviously, we're looking for things at the time that we carry out routine inspections. So we're always checking for things like single-use vapes. We're always checking for things like vapes which are non-compliant with the compositional regulations and for vaping products. As I say, we carried out some online work, and the online work was also looking at things like basically the safety of the products. So basically whether the products that were being sold online were they compliant with the composition requirements for vapes, and we were funded for that work basically by the Department of Health. We also carry out intelligence-led work. So these are inspections where basically we've had a member of the public come to us and say, well, I think there may be a problem here, so that will trigger a visit. And then finally, obviously, in that field, we've got the targeted operations for things like illicit tobacco, and targeted operations for things like vapes, basically non-compliant vapes. That can lead to investigations. It can lead to product seizure. So there's the picture there basically speaks for itself. Basically, over the time, it sees significant across the PPP area volumes of non-compliant vaping products, and then ultimately, of course, it can lead to prosecution. So just very quickly looking ahead, obviously we've got the tobacco and vaping bill in. Obviously, we're looking at the smoke-free generation within that. which is going to be interesting. It'll be interesting from the point of view of enforcement, because obviously we've normally been used to carrying out enforcement operations based on a set age. So in terms of tobacco, 18, in terms of vaping products, 18 years old. But obviously with this particular one, I don't know what we're going to do, whether we have to employ somebody at 15 and they grow older with us as a service. But obviously it's going to be interesting to see how that develops. And effectively, a lot of the rest of the Act, there's new powers in there, there's new and things like that. But a lot of the rest of the Act is actually an enabling Act in the sense of it allows the government to bring in controls for certain types of vaping products, you know, flavours and any other controls basically that they wish to bring in. Proposed within there is a licensing regime for tobacco and vapes. That will come down to the local authorities. It's currently proposed. What we don't know is that whether that's going to be an extension of an existing licensing regime or a completely new licensing regime. But there will be that will be brought in. Locally, we're going to bring in, and we were due to start this in December. We're slightly behind, but we are going to bring in our own responsible retailer scheme. And we have received basically some additional funding for enforcement. Now, it's not very often that we get funding in terms of this type of work, but there was a commitment with the new bill that enforcement would be funded. And in fact, the Department of Health funded 81, I think it was 81 or maybe 80 something new staff within trading standards. And because of this shared service, we were fortunate enough out of the sort of 200 or so trading standards authorities to secure 2 of those. So we've done very, very well there. And that funding is to pay for them to train. And the Department of Health have developed a new level 6 of work with trading standards to develop a new level 6 enforcement apprenticeship, trading standards enforcement apprenticeship, which focuses on enforcement and the public health elements of tobacco. So we've got those 2 officers now in post, and they're settling in, which is allowing us to take some of the work forward. And finally, obviously, I've talked about the joint working opportunities, and Charlotte has alluded to that. So I'll leave you with one final slide. So we had an operation before Christmas. We have one other asset that is available to the service, and it's Griff. So Griff is a detection dog, and we have access to detection dogs as part of the funding arrangements that we have with the Department of Health. And this was a premise in the borough. Obviously, I won't go into details because obviously the matter is still under investigation. But there is Griff with quite a sizable quantity of quantity of illicit tobacco that he identified in a concealed unit under the counter. Very proud of himself as well. So that's all now in our property store, evidence store. So I'll stop there. I'm very happy to answer any questions.
Okay, thank you very much for your presentation, Sean. So we now move into debate. So are there any questions from anybody?
I have one. On Great Hollands, I'm on the clinic side, and we have a smoking cessation once a week. And we've 2 practices there, but there's only one practice that actually refers their patients to the smoking cessation. So perhaps we could encourage the GPs to have a bit more input into this. I found that it was just one practice doing the referrals.
Yeah, so they are looking to improve. They've recently gone around and contacted all of the GP practices to encourage them to send the referrals. They actually offered all the GP practices to actually go through all of their patient lists and contact every single smoker on those patients. Yeah. So they have offered that. So we've tried to encourage the GPs to take up that offer. Yeah, I think we're still working through some of those.
Okay, thank you.
Councillor Harrison.
Yeah, Mr. Murphy. It's important that all the actions we take are evidence-based. I'm sure you've read up on this in great detail. You mentioned earlier the reduction in the size, the 10 cigarette packets could no longer be sold, only 20s. I was wondering if that's a little bit like banning selling half pints in a pub and only selling pints. Is there actually an evidence base that says that that will cause people to smoke less, because it would seem to me intuitive that it would cause people to actually smoke more once they've gone and bought some.
I think it's linked to the fiscal policy. I suspect that's what it was, Councillor Harrison. So if you look at it, I don't know basically, has anybody in this room got any idea what a packet of cigarette costs today? I suspect you're all, what would
We
you
up
think?
about £15 now, maybe?
Yeah,
Maybe
about 50,
maybe
about
about
50,
10 when I last looked. Yeah.
about 15, 16 pounds.
Yeah.
Basically for a packet of cigarettes. So basically, I guess that it's 15, 16 pounds. That's been a big driver to stop people smoking. Basically, you know, it's one of the things that has driven people away. There's no question about that. All the evidence, Charlotte, I think, suggests that, doesn't it? That taxation, revenue, cost has driven a lot of people to give up. Basically, or move onto vaping. I guess the argument would be, Councillor Harrison, that obviously if there were packets of 10, they'd be £8, and they're still within reach. And of course, at the time they were banned, which was many years ago, they were the ones that were most commonly accessed by young people.
Yeah.
And that was the rationale at the time. In the same way as basically the rationale was with vending machines again was around access by young people, because I mean, you know, again, going back to my younger years, you know, the vending machines were always by law supposed to be supervised. And in the end, basically, I think, you know, some of them did put them behind the bar and things like that in pubs and things like that. But quite often they were in the lobby. They were out of sight, basically. And, you know, there was plenty of evidence to show, again, that they were being used by children. But these things are, you know, it's an interesting debate about basically regulation and the impact of regulation and freedoms and all of that kind of stuff. And I think it's you know, it's one that we often have. And you know, and it's quite a complicated debate. I mean, going back to what Charlotte was saying about vaping, smoking's a really easy education message now. You know, basically, it's been a really easy message to get across. I think people, you know, that clearly understand the impacts of health. You know, lots of people have been affected by people in their own family with the impact of health. Vaping is a really complicated one to explain to young people and adults, but particularly young people, because obviously they're designed, they're attractive products, and basically, you know, whatever the message is about the uncertainties, the message by and large is they're safe and harmless. That's what people hear.
Flavours are not. There's so many fruit flavours and things. They think they're not.
Yeah.
They don't actually think they're smoking
Yeah.
tobacco.
Okay. Any other questions, please? Councillor Welch first.
Yes, so I have a couple of questions for Charlotte. In regards to targeted outreach for adults rather than school children, are you able to work with the bigger companies who employ the manual workers? So obviously we're finding it's a high amount. Is that something that you have in scope or you can do?
So we, as a separate programme of work, we have a Healthy Workplace Alliance, and we have been working with some of our really big employers and branching out. Got some really good relationships with Waitrose and other. So we are linking the smoking cessation and the outreach into that Healthy Workplace Alliance, and that relationship is only growing. So we've got that's certainly a route through to reach some of those manual workers within the borough, so that we're going through the employers rather than the individuals.
Yes. Second question was, you mentioned the new role that's going to be in place. Is that going to just be for the borough or for the region?
The Public Health Tobacco Control Officer, that's just for the borough. So that she sat within the public health team. It's funded by the supplementary grant, and the focus will be Bracknell Forest.
Thank you.
Okay, Councillor Dodd.
Well, it was just to follow up on the Healthy Workplace Alliance. I've been to a couple of their meetings. They're really good, and I'm sure they'd welcome anyone from this panel to go along with them.
Yes,
Right. So if you're interested, could ask who, I don't know who's called. It's not
Louise.
Louise. You could ask if she could.
Yeah. we can take that away and
I have to go because I've got to send a meeting, but thank you very much.
Sean, going back to advertising, for instance, I mean, I've been looking at, over Christmas, a lot of old programs on talking pictures, and it's quite extraordinary. Everyone's smoking. It's extraordinary. I mean, when they put one out, they light another one. Now those days have gone, but I mean, I'm just interested in France because I think you can still smoke in France, can't you? Into bars and things. I don't
think you can anywhere now. I don't
You
think
can't,
in Europe. But
I
funny
just
enough,
wondered how we.
and it's enforced by the police over in France. We've got, and some countries have even tougher laws than we do now. I know, for example, when I was over in Italy once. I was looking at the legislation over there. I was looking at a notice there, and what they were saying was that basically they're very big fines for smoking in enclosed spaces, and they're double if there's a child or a pregnant woman on the premise. So there are our controls now are pretty well aligned with a lot of, I suppose, certainly a lot of European countries. But yeah, it is when you look back at those adverts and things like this, and sometimes I do use them in presentations and things like that. It's interesting to get some of those adverts out and some of the marketing stuff out that was around them. But they were different times, weren't they? And but what's interesting, going back to the promotion, we're seeing obviously with the vaping products and going back to the new legislation, everything else, and I don't know what impact that's going to have on promotion. But you go into premises now, and there's whole walls of vapes. So those promotion and marketing tactics that were around many years ago, when you used to go into shops and there would be big, tobacco branded name things everywhere. Basically, they'd even be on the signs, wouldn't there, outside the shop? We're seeing basically, obviously, it's a much it's a much safer product and everything else, but effectively they are very, very heavily marketed as products. And I think that's obviously going to be one of the things. They're very colourful, they're bright, there's lots of flavours, all of those kind of things. And it'd be interesting to see basically where the government go with this, because I don't imagine what they want to do is to put people off vaping, those people who use vaping to get off tobacco. It is.
So manufacturers will find another way of making money. But I was with someone with vaping, right? He went on to vaping. It was in an enclosed room, and I was amazed how toxic vaping is. I mean, yes, I don't know. If we've done much studies, I'm sure we're doing it now. But it seems to me, it's like you're leaping from one problem to another, frankly.
Well, I mean, it's clearly whatever the evidence is at the moment that we've got, all of the evidence points to the fact that it's much safer. But I think what's interesting is, going back to your point, Charlotte, is that we're starting to see people start vaping that never smoked. And it's the same with young people. A lot of those young people have never been anywhere near tobacco products, but basically are vaping. And I think, that's going back to the public health message, that's the message that I think you're working on, isn't it? That it's those people that really we want to discourage, particularly young people.
Absolutely. Can I just ask one last question about statistics? And I was trying to find it in the pack, but is it males that are more prevalent to smoking? Is that in the statistics? It's more like boys and young men. Than women, or was that wrong?
I think locally that trend is that we do have more men than women who are smokers, but it's possibly linked with the manual work and so there's potentially other factors at play that explain that pattern, as opposed to it being a true gender divide.
Yeah, interesting.
I've just got one question actually from Charlotte. Talking about vaping being used as alternative by giving up smoking. Do we have funding in our smoking cessation scheme for prescription drugs to be used for giving up smoking? I know they've been quite successful. There's some new drugs on the market, and if so, do we have access to the funding for use of those drugs?
So in terms of the the contract that we have with Solutions for House, part of their offer, we have the swap to stop, not shop, offer, and then all of the NRT, the nicotine replacement therapies, that's all part of that.
The actual prescription.
We have
actually
prescriptions as well, yeah.
It's 2 or 3 that are new on the market.
Yeah.
And they've just got funding for it, haven't they, from the NHS just recently?
Yeah, so that's all incorporated into the
Yeah,
contract.
as part of their kind of initial assessment, they kind of identify what they
Lovely, thank you. Are there any other questions? We'll just debate. Okay. So do we have any recommendations today? So
We recommend we endorse the strategy.
yeah, we endorse the strategy to say it's positive, and the updates for the future will be brilliant to be kept up to date with anything new will be super.
Sorry, this isn't a smoker scoff.
So with that, I'd like to thank Sean for the great presentation. Thank you to Sean.
Pleasure.
Great. So I'd like
Thank
to
you.
thank you. So do we want to go through recommendations? It's fine. So I'd like to thank everyone for attending. I now declare the meeting closed. Good night.